right, everybody. Well, let's go ahead and get started. I think we'll have a few more people trickling in. But again, thank you so much for joining us either this afternoon or this morning, depending on where you're calling in from. I am particularly excited about this webinar as we are rolling out a new toolkit and resource for all of you to access. And we are so excited to be joined by several of our state partners today who were integral in the development and implementation of this toolkit. So without further ado, we will jump right in. And I will do some introductions of Kathy and Hilary shortly. But again, we're so excited to have all of you joining us. Particularly, we know many of you listening in who are traveling and attending conferences of all different kinds last week. So we're grateful to have this time this afternoon together to share with you a little bit more about our toolkit for states to implement newborn screening education, particularly around the prenatal period. So a quick outline for what we hope to cover over the next 45 minutes or so. And for those of you who have attended webinars of ours in the past, this is a structure and format that we use for a lot of our training and a lot of our education opportunities, where we first want to really build your awareness and your knowledge. So I'm going to take a few moments to walk through an overview of the Newborn Screening Education and Communications Workgroup that has been meeting for the last year to develop this toolkit. And then we're going, and we have the wonderful opportunity to hear again from our amazing collaborators in Colorado and Tennessee, who are going to share their firsthand experiences implementing prenatal education initiatives in their states. And then lastly, we hope that we can leave you with some specific opportunities and actions where you can begin to jump in and think about prenatal education programs in your states. And we recognize that, you know, many of you are already doing this and are already working towards or have already implemented prenatal education activities. But we hope that with the development and the sharing of this new toolkit, that you will have access to some even more helpful and additional resources to support that journey for you. So I want to first start by laying some context of the work group that has evolved over the last year to create this implementation. We really came together, and I'll go into a little bit more detail in just a moment of who was involved in this work group, but we all came together from the same background of recognition and understanding that the problem we were really trying to solve with the development of this toolkit was to support education for expecting families around newborn screening. I know many of you on this call have heard time and time again, that families are really not aware of newborn screening prior to their baby's delivery or prior to the phone call that they may receive regarding an out-of-range result. And so we hear the unfortunate stories of families who just don't know this information and are caught by surprise when they receive that news. We also know that, particularly there are large numbers and large groups of families from communities that are harder to reach or that historically have not had access to this education and this information, who are even less aware. And so for these reasons, and also knowing that many of you who work in states, whether in the lab or in follow-up, and who are working with programs, have tried for many years to really think about how to best implement prenatal education for newborn screening. And so understanding that context and really being passionate about trying to make that process better, that is the context and the background for where this education and communications work group started. So about a year ago, between September and October, we began recruitment for individuals to participate and join in this work group. And we were really excited to see a great mixture and representation from members of the community, both members that are working within state programs, again, whether some were on the laboratory side, some work in follow-up, but a good mixture of states who are participating from the state program perspective. And we also had a number of families and individuals who they themselves have had experiences with the newborn screening system, whether that be a child that was diagnosed through newborn screening, whether that be a child who was not diagnosed through newborn screening, but has had a condition for which advocacy has been happening to have that condition added to the RUSP. And so for a variety of different perspectives and reasons, these individuals were interested and willing to jump into this education and communication work group. And so when we completed recruitment at the beginning of October, we had representation from 15 different states. And so we were really excited to have such diverse perspectives and backgrounds that could really represent large and small states, rural and urban communities, and a variety of different perspectives. Within this work group, we met 5 different times beginning at the end of October all the way through June. And I will show you a bit of the roadmap that we used. When we initially met, we knew and had agreed by agreement to participate in this work group that our end goal over the next year was to develop a usable tool. And I emphasize usable because we really wanted this tool to be practical, to be easy to use, and easy to facilitate implementation across different states. So that really resonated throughout the work group. But the goal was to develop this usable tool to support state newborn screening programs in their efforts to implement prenatal newborn screening education initiatives. And so we knew we had quite a lofty goal to accomplish this over truly less than a year. And so we set out to follow this roadmap where we met for the first time to really do a lot of reflecting and understanding of what are the current barriers to implementing prenatal educational efforts around newborn screening, what are states and families experiencing, and how can we incorporate that perspective and experience into the tool that was then shaped. We spent the following several meetings discussing what a tool could even look like, what would make the most sense, and what would truly make it practical and usable for state programs. And so we met numerous times to iterate on that and gain insight from the various different work group members. We also incorporated a lot of survey and kind of insights collection to be able to capture that really important feedback, which ultimately did shape the way that the tool evolved. Around February and April, we had a version of the tool that we were able to share with members of the work group who were able to, test out and incorporate or implement specific areas of the toolkit in the work that they were already doing. And so based on that, we were again able to iterate, review, and revise, and had a final product that we were able to produce for this work group this past July. And so this webinar is really our opportunity to share more broadly with the newborn screening community this tool and make it available to all of you for use. As this work group kicked off this initiative and this work, there were really 3 main questions that we used to really hone in our focus and to keep us centered on that idea of creating a truly usable tool, a tool that isn't going to just sit on the shelf, but that people and programs and individuals would be able to use, whether they use the whole tool or a part of it, that there is something in it that is practical and helpful for you all to use. So those 3 questions were, what do states need to successfully implement family-centered newborn screening education? And truly a philosophy of ours at Expecting Health is, in order to effectively build tools and meet individuals, families, labs, all of the different stakeholders that we work with where they are, the most important piece to that is to involve and incorporate the people that would be using the tool. And so that is exactly why when we did recruitment, again, it was so important for us to really have a diverse and depth of knowledge and experience in this work group. The second question that really centered us are, what are the outcomes we are trying to improve by educating more families? We often in the newborn screening community talk about the importance of education and how important it is for families to be aware and to know about newborn screening. But if this is really going to be a usable tool, what is it exactly that we were trying to change? And as a group, we agreed, going back to our previous goal, that really what we're trying to change is that awareness and knowledge for families to know about newborn screening prior to newborn screening happening. And then last, we really thought a lot about how will we know if this is a successful tool? How will we know if this tool is usable and that it truly does impact the outcomes of families before they have newborn screening? And so I think you'll start to hear answers to these questions as we learn from our speakers and the experiences that they've had as they've implemented various different programs. But just to keep in mind that these are really the 3 grounding questions that we return to often in our discussions as a work group. So I am going to briefly walk you through a high level of what is included in the implementation toolkit, and we will certainly provide a link and access to this toolkit so any of you are able to access and view it in more detail after this webinar. But we aligned early on as a work group that the toolkit really focused and was divided into 6 main domains. And these are the domains of implementation, many of which, were provided and input was shared from the work group members based on other programs that they had implemented, as well as, implementation science and things of that nature. So the first domain was really the importance of identifying the right partner identification. The second domain focuses on the development of a project plan. The third is the importance of workflow design and really integrating into existing workflows. The fourth domain is on material development and really understanding what materials would be needed and used for the initiative that was being launched. The fifth section is on evaluation and data collection. And again, we spent a lot of time. I won't go into all of the details around the evaluation and data collection today, but I will call out that we spent a lot of time and emphasis developing an evaluation guide that could be used, recognizing that we really did want to be able to measure the impact of this prenatal initiative in the states where it was being implemented. And the way to best do that was to think about what data we could collect and how would be the best way to collect that data. And then the last and final domain really centered on the success of program launch and what would be needed to prepare clinics, to prepare staff, to prepare all of the other groups that might be involved in launching this initiative in your particular location. So I did want to just highlight to give you a sense of what you will find in the toolkit, a few of the tools and resources and some of the tips that are included. So each domain does include a short checklist to help guide states and their partners through the implementation process. And so again, we spent a lot of time really thinking about what is the step-by-step process each step of the way. And our hope is that while individuals using this toolkit may not need every single step, some of that may vary based on your location, your program and clinic needs, and who you're working with. The idea was that if it's all listed here, it gives you at least a reference and a checkpoint to walk through and to flag what you do or don't need to integrate. Each section also contains tips, resources, and even templates that you can print, that you can fill out, that really are designed with a lot of thought and input from everybody that was a part of this group. Again, to simplify the process for you and to truly, help you have the tools that you might need, not only to think through the project, but to actually implement it as well. And as I just mentioned earlier, there's a pretty robust section on establishing the evaluation measures, and we do include specific evaluation questions that were utilized in some of the pilot sites that we were able to partner with, so that you can get a sense of what types of questions were utilized with the actual prenatal initiative. To build on that, as you can probably imagine, even prior to this work group, there were a number of very specific resources that were created in conjunction and collaboration with members of the work group, as well as many families and many of you listening in, that really tried to simplify the education process that is happening during the prenatal period, but to, again, make it really easy to incorporate this education into existing workflows. So we developed, and these are included in this toolkit, things like a poster that could be hung in clinic exam rooms, that could be hung in waiting rooms, that could be hung in community centers, that could be shared with various different birthing providers. So again, we really, in the development and design of these tools, tried to embrace the idea that prenatal care and prenatal education is happening in a wide variety of places, and that these tools could really be tailored and applicable in any situation. And so we have a poster that can be printed and shared, and it links with a QR code to an education book that was specifically designed for expecting families to learn more about newborn screening. In the middle, you can see a patient information card. This was used, and you'll hear our guests share a little bit more about this as well, in several of the pilot sites as a way to interact with and in clinics for individual clinic staff members to share information about newborn screening and to guide or direct their patients to an online learning tool. And then again, many examples of evaluation questions that were used to try to measure the success of the activity that was being implemented. So lots of great things that are available, and that's just scratching the surface. The toolkit itself is extensive. When you first download it, there are a number of additional tools and resources that I did not cover today. So we want to make this available to all of you. You may utilize this QR code. It will link you directly to the complete toolkit, and we will also drop a link in the chat box now. So anyone that is interested in seeing more of this, you're more than welcome to download and access this toolkit with those resources. So with that, I am so excited to turn it over to our wonderful collaborators and guests from Colorado and Tennessee. And we're first going to hear from Ms. Kathy Inkhamfong, who is the newborn screening educator and lead follow-up and education specialist in Colorado. And then we will, following Kathy's presentation, hear from Hilary Fryman, who is a newborn screening nurse educator in Tennessee. So I am going to stop sharing for just a moment and switch gears to Kathy's presentation. And then turn it over to Kathy. Mm-hmm. Okay. Kathy, can you see that?
Good morning. It's still lagging on my end. I don't know. I still can't see it on my end.
Okay. Let's try this again.
Got it.
Oh,
nope. I see it now. Sorry.
So that's okay. One moment. Okay.
Okay, great. Well, good morning. As Marianna mentioned, I'm Kathy Inkhamfong from the Colorado Newborn Screening Program, and also good afternoon if you guys are on the East Coast. But today we can go to the next slide. As discussed in the previous webinar, we started by crafting our prenatal education project by utilizing a detailed project plan. And with a background in project management, we're able to keep track of all the moving parts and a variety of the components. And the goal was essentially to increase awareness to expecting parents, as Marianna mentioned, well before the actual heel stick takes place. And we wanted to maintain or even decrease the rate of refusals in 2023 in comparison to 2022. And as Marianna mentioned within the toolkit, this is our overall process that we use, and it's very similar to what's referenced in the toolkit. So throughout this process, of course, we have continuous quality improvement threaded throughout the process, but it really began with the creation of the content, the design and translation of materials from our internal vendor within the state health department. And the most important part was certainly getting buy-in from a specific point of contact in the birthing centers we partnered with. And we worked with them to identify a part in their workflow that enables us to distribute our materials at a timely point to prevent impeding on their existing processes. So we determined the monthly birth rate for a 6-month supply. There was no logic behind that, maybe due to storage purposes. 6 months was a pretty good amount. And we scheduled meetings, a pre-meeting, a check-in meeting to see what's going well and what's not going well. And it's important to really emphasize the need for feedback because we do want to ensure that we're just continually improving. So if we go to the next slide. So basically, with all the steps of what I described, we applied it to version 2.0. So the feedback from our stakeholders was that it was a lot of paper material to give to families, and that the feedback provided was that the brochure and the first versus seconds materials was the most helpful. And so instead of the 4 resources prior, we cut it down in half. And the brochure actually includes the QR code for the Expecting Health flipbook. And it was great to see.
Uh-oh, I think we may have lost her. Oh, you're back.
I am back on. Are you able to see and hear me?
Yes, I can hear you
I'm
now.
telling you, my luck with technology is just not going well, but I apologize.
Feel free if it helps turn your video off too. That might help a little bit. I know we'd love to see you, but if that helps you stay connected, then
okay, let's do that. But basically, with all the steps as described in the overall process, we applied it to version 2.0 and minimized the materials used. Instead of the 4 resources, we now just provided the 2, which is a general brochure that has the Expecting Health QR code, and then also our material that compares the first screens versus the second screens. And with Marianna's help, we were able to really see the average time spent on the flipbook. And between Spanish, Dari, and English, that was about 2 minutes and 38 seconds. And so it was great to see that we were getting people engaged in it. And we can go to the next slide, please. So in Colorado, there's about 65 birthing facilities and about 56 counties. And 2 counties, these weren't chosen intentionally to have like the same hospitals in the same county. It just happened to work out that way. This provides the population size of both Boulder County and El Paso County and where they're located in the state. And I would just like here that there are hospitals within the same healthcare system because we really leverage the connections we have within clinically integrated networks, also known as health systems, to really see who we can establish a connection with and work with to provide resources to them. And if we go to the next slide. So this was great because it outlines the preliminary data. It shows the average birth rate for 6 months and the refusal rates compared side by side for both 2022 and 2023. Birth trends are included to kind of give you an idea the size of the birthing center. So for the lighter of color, that it represents 2022, the percentage of refusals from January to September. And the more highlighted ones are 2023. And green obviously is associated with good. So we can see that there was a decrease with those highlighted facilities. The yellow is actually an outlier in our data. The reason being is that we kind of saw that UC Health Longs Peak Hospital in Longmont, Colorado, had a very high refusal rate. So we reached out to them to inquire, and we were able to find out that they had a new birth registrar who fills out all the birth worksheets for birth certificates that gets to vital records. And it was just historically known just to put refused or declined for the newborn screens. And so that's why that number is so high. And with that, we see it drastically change to 0% since we worked with the educators to ensure that everything was being filled out properly on their end. And then with the red, it's just interesting that those are two different facilities within the same city, Colorado Springs, and there was a slight increase. So overall, this is preliminary data since we do want to see the overall data after 2023 and maybe do it longitudinally and determine statistical significance later down the road. We can go to the next slide, please. Awesome. So the considerations I would take into account beyond this version would be that thinking about a strategy to really work with OB/GYN offices. I think other states share the same challenge about connecting with these providers because they feel as if the baby is not their patient yet. However, it is a requirement of ACOG, the American College of Obstetrics and Gynecology, to discuss newborn screening. And so if there is a network or connection that you know, I would highly suggest starting there. And in addition, expanding to pediatric offices in midwiferys. And the next point I would make is just make it memorable and engaging. And that can be through storytelling from the family's perspective, including swag, which is an attention grabber. And for, as mentioned, for like pediatrician offices, this could be a great time to include FAQs for families or fact sheets for families. And next slide. So overall, I would stress using different forms of multimedia engagement. So there is my chart, which is, I think, a common app used throughout various health systems, allowing you to see your results even prior to your provider letting you know. So maybe integrating a form of educational material within that. And then the Yomingo app is a pregnancy application, and that actually includes educational materials for expecting families. The most important piece, I would say, is that the resources are only as valuable as a point of contact. Makes it a priority to integrate it within the existing workflows. If we think about newborn screening as a system, healthcare in itself is a larger system, and finding the best spot to fit in is probably the most challenging. And having someone who's able to really be a big proponent of newborn screening is important. Another thing is just having the whole team proofread everything. You can definitely get tunnel vision, so it's great to have an outsider perspective as well. And with the minimization of the materials we had, the simpler the better. I think we're getting away from having paper copies of things, so having minimal materials was more fitting for majority of the facilities. So I think the next slide is just our contact info. And then the last slide is just a thank you to Expecting Health for working with us, and just thanking my colleague Desiree Neibauer, who's done a lot of work on this. So thank you.
Thank you so much, Kathy. Lots to be learned in that experience and in that journey, and certainly grateful for partnering and for what we were able to learn. I think one thing in particular that really stood out, and you just highlighted it, is the point of contact. So often the point of contact, whoever that may be, is the first individual to introduce newborn screening to a family. And if it's a passive approach, it may just kind of fall to the wayside. And if it's a more proactive approach, and I think a lot of the tools that have been developed prior to and during this work group have really pushed for a more proactive approach to engage families. that really seems to make a difference. So it can still be, a brochure or card, but if the person that's passing it to a family is engaged and shares the importance of it, it does change the process. So thanks for pointing that out. All right, Hilary, I'm going to stop sharing my screen and turn it over to you so that you can walk us through what you all have been doing in Tennessee.
All righty. So just to give a quick overview of kind of our process, how it all started. So this is a really high level overview of everything that took in the behind the scenes. So it all started with Expecting Health giving a presentation at the symposium during the pandemic while we were all at home. And I was like, they're doing what I just thought with the QR code. And so reached out to them to start the meeting, which went through meeting with me and my manager and Expecting Health, and then up the chain of senior leadership. So there were multiple planning meetings and approval by the leadership. We went through flip book revisions for state specific and the Spanish. One of the things that we revised on the Spanish flip book was the title of it. One of our within our department is a Spanish interpreter, and he was saying the navigate and newborn screening, the translation was a little bit confusing, so we reworded that to make it a little less confusing. In the midst of this, the work group was generated to start this implementation toolkit. So we worked on that. And during this time, I had identified a site that is a OBGYN clinic. And like I said, I wish I could tell you that it was easy as these 5 boxes, but this is like a 1.5 to 2-year long process to get going with all of the approval processes and competing projects. So the initial seed that was planted was in June of 2022, and I actually was doing a virtual education clinic, virtual education with this clinic to start collecting the dried blood spot filter papers in their office. And I just mentioned that we were going to be having this new initiative. And that's when they kind of chimed in and they're like, oh, well, we're also an OBGYN clinic. We have new residents that rotate through our office, and we'd definitely be interested in working with you. So my initial seed planted from something, a completely different type of conversation. So in June of this year, we were ready to launch, and we sent an email to the contact, and we had a kickoff scheduled for the end of the month. And then after our kickoff, we did training with the clinic staff, and then they chose to go live with the prenatal education flipbook on August 1st. And the clinic selected August 1st as the go live date because medical students graduate in July and start their residencies, and OBGYN residents rotate through their clinic. So they only wanted to do like one education with these group of people, and they didn't want to wait longer where they had to reintroduce a new education initiative. So if they could catch them all on that front end, it would make it easier going forward. We determined that we would do a 2-month check-in in October and then a 4-month check-in in December. So using the implementation toolkit, during the initial kickoff call, we provided an overview of the need for prenatal education via a PowerPoint. We utilized the kickoff call questions on page 16 to gauge what they are already doing versus what was going to be a new system for them. We determined our project champions, how the information would be disseminated. We determined that after the medical assistants completed vital signs, they would review the information and provide the patient education card for the family to scan. We also discussed that the glucose testing in their clinic would be another opportunity if for some reason it was missed on one of the visits, because they do that in their clinic, so it's not a different lab setting. The information was going to be disseminated at the 28-week depression screening. And so they kind of incorporated the prenatal education into the checklist in their EMR. We determined that some of the potential barriers and some of the strategies to combat those, they do have languages that we do not have translations for. And so if they had a family that we did not have a translation, the MA would review that information with the family using the interpreter service. Technology, if the family didn't have a smartphone or if there was poor service, a paper copy would be provided to the family. And if there was family had a low reading ability, the MA once again would sit down with the family to review the information. We discussed how we would evaluate this pilot project. And so, like I said, a reminder was added to the EMR for the 28-week appointment to ensure staff has completed and documented the education. The clinic is going to create a report to pull information on how many families received the information. At the conclusion of the pilot study, clinic staff will provide feedback about implementation via a short survey. So we're taking a little bit different approach. A lot of it has been family centered and what families are getting out of it, but with the lack of buy-in that we're getting from providers, I wanted to use this clinic and their feedback to use when I approach other facilities and other clinics so that I can give them firsthand knowledge. And it's not previous focus studies that were done several years ago or secondhand knowledge just coming from me about how great it is and what, what families can do. So I wanted just to take the provider approach just so that I can get that additional buy-in. We also met with our Office of Communications to determine how we could use the state website analytics to determine the number of views and impression. Our Office of Communication made the website that the QR code links to hidden from any public search engines so that we could gather the use of the flipbooks based on the clinics that we're going live with and that we've onboarded so that we could have cleaner data. At the end of our kickoff call, next steps were established and emailed to the clinic leadership. So I printed and mailed copies of the flipbook and patient education cards to the facility. And then the clinic closed that loop with me and let me know that they had gotten it. We did education with the clinic staff scheduled for the following month, and then determined the clinic would add a reminder to their EMR. During the training call with clinic staff, it was similar to our kickoff call where we provided the overview and the history. We provided staff with a script and communication guide from the Implementation Toolkit. The communication guides provide suggestions for troubleshooting using the phone camera to scan QR codes, because that's inevitable that somebody is not going to have one little button selected and their camera is not going to scan the QR code. And at the end of the call with the staff, we would determine that we'd follow up in October and December. Our October follow-up was an informal email check-in, and December will be more formal. So in my 2-month check-in, I sent an email to our project champions with a few questions, and I thought I was being really thoughtful with the questions and to get the information and asking them if the time frame felt that it was best, are families receptive, is the booklet spawning any additional conversations, how are the staff feeling about providing the prenatal education, any hesitancy, has it added any burden, and has the additional chart documentation added a burden, and are staff complying? And to my surprise, the response was minimal. There were no issues. So I cannot determine any of the other things. So hopefully in December, we can have a more formal conversation and get some of this information. But the clinic manager wasn't aware of any issues, and she deferred to the OB coordinator for a more detailed response, which I've not gotten. So I'm hoping no news is good news. So some of our project statistics, and this is from FlipSnack from Expecting Health in Marianna. So for our English, we've had 8 impressions and 6 views. For our Spanish, we've had 3 impressions and 2 views. And down at the bottom, impression is how many times the flipbook is loaded, and views is counted each time a person interacts with the book. I do not know if they have distributed any paper copies, and I have not gotten any analytics from our state, but I would like to compare our the state Adobe analytics to the FlipSnack statistics. So some of our takeaways and inspiration for anybody hoping to do this in your state. Take what you need from the toolkit and leave what doesn't apply. There is a lot of information, and some of the information may be just kind of, it's habit. You've already done this work. Some you may have to take it out of order, but just apply to your project what you need from it. You want to keep on keeping on, start small, keep it simple, leverage your current partnerships. Don't reinvent the wheel. With newborn screening, there's somebody inevitably you've forgotten that you've engaged before, or there's resources. So leverage those partnerships and plant seeds. Talk about your project or plans whenever possible. This helps keep you engaged, your team engaged, and you're just sprinkling the little seeds wherever you go. And hopefully one day it blooms into a flower. And so some of the inspiration, one step in the right direction is better than 100 years of thinking about it. The best angle from which to approach any problem is the triangle. You want to just do it one bite at a time. So you can pick the part of the elephant that is tastiest for you and start there and move to the untastier portions, because there's going to be an easy portion of a project and definitely a tougher portion. If you have to pause, do it, but don't stop. And then you just want to develop persistence, have that definite purpose, a definite plan, a mind closed tightly against the negative and discourage its influence, and a friendly alliance. So what's next for us? We are, during the symposium, kind of came across one of our former directors of a specialty care center was there. And she started mentioning, she's like, yeah, I'm retiring from being an OBGYN. And I was like, my ears perked up, and I was like, what? So she's going to talk to the OBGYN chair of one of the hospitals that she worked at. I'm meeting with a small group of midwives to discuss implementing the prenatal education flipbook with their clients. We're going to start reaching out to other clinics, and then next spring, presenting this information to our Tennessee Perinatal Advisory Committee. So thank you to Marianna for guiding and holding hands and kind of talking out of some of the spirals in my head, because it's kind of, you just keep thinking and keep thinking. It's like, no, just simple. One bite. So thank you, everybody.
Thank you so much, Hilary. I mean, to consolidate the amount of work, and same for you, Kathy, that has been done over the last year and a half into 15 minutes makes it seem like it was just so simple and straightforward. And I know you both have done a tremendous amount along with your teams to get to where you are. But I think both of you have shared such clear evidence that, yeah, it can improve and it can make a difference. And I absolutely love the way, Hilary, that you all are taking a provider approach as well. You know, I think there are many on this call that are in programs or part of programs where, you know, provider education and really honing in on how to improve that piece is an important step in the work that we're doing. And I think, you know, having these tools that make the process a bit easier for providers and educate providers along the way as well is extremely important. So excited to hopefully get a little bit more feedback from them in the next few months. So we do have a few moments. If there are any questions from the audience, I know we heard a lot and there's probably quite a bit of context that we've left out as well. I should have mentioned at the beginning of this that part of the reason that this work group even evolved in the first place was to support and scale efforts that had been piloted previously and in several years to implement this prenatal flip book that both Hilary and Kathy have talked about. So we didn't cover that today. It is in the toolkit, but kind of the baseline for the prenatal education initiatives that have been implemented by both of these wonderful ladies in their states, as well as others who are listening in, has been this flip book. So that is kind of the main tool, and the work to develop that tool happened about 2 to 3 years ago. I see several faces of those listening in who are part of developing that particular tool. But that is the main point of education for families during pregnancy. And that is what the QR code that Hilary and Kathy mentioned is linking to. And that is a book that we are able to collaborate with states on to tailor and tweak so that it, certainly represents and meets the needs of families in your states and in the communities that you're serving. So that's a big part of the work that was done prior to this work group, and wanted to mention that. The other thing I wanted to mention, as others are thinking of questions to drop in, is there were also, I think Hilary talked about some of the software programs that we've used to implement these efforts. So something called FlipSnack, obviously QR codes were a big part of these projects. So within the implementation guide, we do reference and explain several of the software platforms that we've chosen to implement and chosen to use. FlipSnack is an online book tool that can convert books into digital books. And there is a way that we are able to track statistics, like Hilary showed, the number of views, the number of impressions. And so there is some additional insight and explanation about FlipSnack and some of the other software platforms that have been utilized and tested out within the implementation guide. Any of you have questions about that, we are here to support and help and partner with you in that. So please don't hesitate to reach out to us. So let me double check the chat box to see. So I'm gonna read a couple from the chat box. And thank you, Amy. I see that you all are definitely working towards implementing as well, and we appreciate you for that. So question from Miranda: were OB-GYN providers or midwives invited to be a part of this work group to form the toolkit? Since they are the intended audience and necessary for success, just curious. Great question, Miranda. We did not have an OB-GYN. So in an initial pilot site that, again, outside of this work group that was utilized to develop some of the resources, we partnered very closely with an OB to help inform and help create the tool itself. Both Kathy and Hilary were working with OBs in their communities as they were implementing these projects. And please feel free to jump in, Kathy or Hilary, if you'd like to. In terms of the work group, there were not OBs that were a part of it. We were really focusing mostly on the family and the state lab perspectives, but great. The work is not done and we have lots more to go. So definitely always an opportunity to include even more perspectives. So Hilary and Kathy, I actually have a question that I'd love to ask, and either one of you or both of you can elaborate on this. You both mentioned the importance of having champions in the implementation and in the work that you were doing, in the clinics that you were working with and those that you were reaching out with. So I'd love if you could share a little bit more about how those champions were identified and how those relationships were cultivated. I think that's a big part of what can be hard about this work, is finding the people that will support this work. So any insight that either of you have on that, I think would be really helpful.
Yeah, go ahead, Hilary.
Just speaking from with Tennessee, it started when I was doing the education. They were seeing an influx of having repeats or doing TSH low birth weight repeats. And they were like, what's stopping us from doing this in the clinic? So my initial contact person was one that had reached out just for the education on the dried blood spot collection. And so I utilized that previous connection, and she brought in her medical director. And then we also, one of my champions is the OB coordinator, who works more with the staff and the MA staff to kind of implement those. So she just kind of branched out to the clinic leadership.
And then from Colorado's perspective, I kind of started with just a blank slate. So it involved calling the actual labor and delivery departments and asking who the best person to reach out to was, like their nurse educator. And with that, we also established connections like with the labor and delivery department, with the NICU, and then with the laboratory personnel. So it's really great to have stakeholders at all different levels to integrate. And so we did that by establishing our like hospital champions, which are exemplary facilities that have great quality indicator metrics for things such as like missing demographics or unsatisfactory specimens. So we checked in with them and used that contact to find the right person to see about prenatal education. And we found that a lot of educators were willing to share that they are resuming to do tours again for the birthing centers for expecting parents. And we found that opportunity as our way into their workflow.
Yeah, thanks for that. And I'll just add from the pilot sites, even before working with you all, I think definitely it took a little bit of time to cultivate and identify. I think one of the big takeaways that we learned from the work group is that the perinatal quality collaboratives were brought up and discussed early on in the work group discussions, and those were other that's a national network. And so those, if there are no connections in your state to start with in terms of prenatal providers, whether that be OBs, midwives, doulas, the perinatal quality collaboratives and the network of the PQCs can be a good place to start. So fantastic insight. Okay, any other questions from the audience? I don't see any. Yep, glucose.
There's a question from, oh, I'm sorry.
Oh, go ahead, Ebony.
There's
Thanks.
a question from Kelly Connell. For Tennessee, are you planning on rewriting the material for your midwife group with specific language?
No, we're going to use the same flip book. The flip book actually mentions that it's 24 to 36 hours after your baby's birth, a nurse, midwife, or other trained. So it already includes midwife population into the flip book. Otherwise, it's just Tennessee specific information that would be for if they were born in a hospital or born at home with a midwife. So it should span the gaps.
Thank you for answering that. And it looks like one last question from Ashley Comer. She says, I know both of you have experience with quality improvement, and education can be difficult as an intervention for quality improvement. Can you share one takeaway how this project was structured to help measure or see improvement?
I can answer that question first. So for Colorado, I think with the data that we obtained from 2023 can be compared with 2022. We can narrow it down even further by county and ethnicity even. Like I would love to drill down deeper into the data and see if there is a trend with refusals or declines within that specific county. So I think those are the measurable objectives that we'll focus on in terms of quality improvement. And I hope that answers your question, Ashley.
Wonderful. Well, thank you both so much again, not just for sharing your experiences today. Those were incredibly helpful, but for just your continued, dedication and just work towards getting to this point. I hope you both feel very successful in what you've been able to accomplish, and we're grateful for the lessons learned and the insight that you were able to share with us today. So as we wrap up, I am going to share my screen one more time and just wrap up with a few opportunities for all of us. And I think as both Hilary and Kathy shared so well, they have a vision for scaling and for growing and for continuing to expand this work in different ways, as do we. And really, again, that was one of the primary reasons for creating this toolkit and to be a support for others who are trying to implement this work. We know many of you are already doing it. We've not talked today about a lot of the barriers, but we know that they exist. And so, this tool was really meant to be a support and something that is accessible to the newborn screening community and usable, truly usable, as a whole or in bits and pieces. So in terms of next steps and thinking about how we as a newborn screening community can continue to grow these efforts to raise awareness, educate, and just bring knowledge and confidence to expecting families prior to newborn screening, first and foremost, feel free to download and use the toolkit. Again, it's bits, it's pieces, or as a whole. And we definitely encourage you all, and again, many already are, but continue to engage with your local prenatal providers. We've heard a lot today about working with OBs, but also working with midwives, and we have successfully implemented prenatal education. We shared this work previously, but with midwives in different communities across the country to be able to do this, working in homes with families. And so really being thoughtful about engaging with your local prenatal providers and connecting and building those relationships that we've talked about. And last but certainly not least, you don't have to do this alone. Hilary and Kathy and the work that they've been doing, certainly I'm excited to bring you all to this as thought leaders in this work. I know there are others that are on this call that have also been doing lots of projects for a long time in the OB and prenatal world. So lean on those that have done this, and please don't hesitate to reach out to Expecting Health. It's a really important time in the newborn screening community. I think with recent funding and shifts, we know that there is an emphasis on provider education as well as family education. And so we are here to help and support that as needed. And before you all jump off, we wanted to give you all an opportunity to share your feedback with us about this webinar. You can scan the QR code. We will also drop the link in the chat box as well. We really do value and take into account the feedback that we get through these surveys. We do a lot of webinars, and a lot of the topics that we end up presenting information on are based on feedback that we get from all of you. So we really, really would appreciate it if you would just take a few moments. It's not very long to drop your comments and share your feedback through this survey. And again, we'll drop the link in the chat box as well. So I'll leave the QR code up for just a second longer, but if you miss it, the link will be in the chat box. And with that, we just, again, want to thank you all for joining us. Thank you for Hilary and Kathy for your presentations and your experience. And if we can be of any help, please do not hesitate to reach out to us. My contact information is here, and these are all the different ways that you can reach out to Expecting Health. So with that, I hope you have a wonderful afternoon, and thank you all so much. Thank you, Hilary. Thank you, Kathy.